People are not aware of the situation because they think dentists are just to give, beautiful smiles. Dentists, they relieve the pain. Dentists are meant only for that. But there is other side of the coin. The dentist also reveals the truth, especially when so many dead bodies are piled in one room. How to give identity to each and every bit of a person. Dentistry always comes first in that. But very sadly, that part is neglected, not given much importance, and above all, not encouraged. Hi friends, I am Dr. Jayasankar Pillai. I am a forensic odontologist and I am working as a tutor in the Government Dental College and Hospital, Ahmedabad since 1997. The journey in this career is full of learning experiences. I started my BDS life in the year 1992 when I got admission in one of the finest government dental colleges in India. That was, at that point of time, it was Pondicherry Dental College. Now it is Mahatma Gandhi Institute of Postgraduate Dental Sciences, Puducherry, and a Pondicherry University. The 5 years was an average student with a dream of becoming an oral surgeon after BDS. Tried hard in the oral surgery departments, tried many surgeries and disimpactions cases during the internship period. But man proposes, God disposes, because the dream of becoming a oral surgeon was always there. But after I graduated, I came out of my college, finishing internship in the year 1997. There was a turning point. There was a need that I have to take a job to support my family, my mother and my brother. Luckily, within 10 days of my graduation, I got job in a government sector. Though my birthplace was Ahmedabad, but I was doing my schooling and college life in southern part of India, Pondicherry. So there was always, some tough situation I had to face with respect to the language. And my second language in my school was French, not Hindi. So coming back to Ahmedabad after graduation, so to get a government job and to deal with patients, it was a very tough task for me. But, gradually I adopted to the situation, because that is one of the best way you can live a life happily. You have to adapt to the situations. So that adaptation to that situation has, made me reach this height. I can communicate with my colleagues, with patients, with anyone in Gujarati. May not be very fluently, but yes, I can do it in both Hindi and Gujarati. So language cannot be a barrier to any person's success. That's what I mean to say here. So getting the job within 10 days of graduation was a real blessings from heaven. Now I literally feel that, how important this job is for me. Because the recognition what I get today, the name, the fame, whatever I can say, is because of the job which I am performing in my institute. And the way the repaying my profession through a dedicated job. So this is how I can explain it. Of course, there were a lot of uh, roadblocks, because in any academic institutes, if you see, there's always a progress to any person, which is always expected. Stagnation should not be there, but because of the lack of MDS degree, having just only a BDS degree in your career, it's always a roadblock to hierarchical or the academic promotions, which I am facing it. But I've determined that these roadblocks are temporary, posts are all temporary. So how best I can utilize that simple BDS degree is what I thought. What are the ways how I can explore in that post as a tutor and come up with some success stories? So I got blessings of so many seniors, guidances from so many people. So I thought that we have to go in depth to the subject. So wherever the posting I was in, so I put my 100% into those things. Like, for example, I can say I was initially in the oral diagnosis and radiology department posted, where we get a lot of cases. The first entry of any patient to a dental institute is the OPD. So I was posted there, and when I started looking at some of the rarest cases, I started, in-depth analysis of such cases, interacting with those patients, trying to get the maximum history I can get from such cases, and try to do the diagnosis perfectly. So like that, I have done certain collection of rare cases in oral medicine. I published those articles. I've got a compilation of some rarest cases which any dental surgeon can face in his or her life. In fact, this is the same auditorium where I presented all those rare cases few years back, like back to basics. That was the topic. How a basic dentist can identify or diagnose a systematic disease through oral manifestation. That is very important. Because we dentists are the one who deals with the oral cavity, not only with dental caries, like many think, only with the teeth. But apart from that, the manifestations of some systemic diseases can be very, very useful to diagnose. So that way, I was playing a very important role during my posting in oral medicine or diagnosis department. Presented and published some of the rarest cases in some journals, peer-reviewed journals. And I didn't stop only with the case studies. Research is a very important leg, one aspect of dentistry which is, mostly neglected by many. Because the word research itself, it says you have to search again, research. Sometimes we do not know what I am doing, what we are doing. So the research component in dentistry was not much welcomed by many in our country. So we already had or we are having an association dedicated for dental research. So I became a member of that association in the year 1998. I got job in 97. In 98, I became a member of that association. Attended conferences national-wide. Every year annual conferences were organized. I used to attend. Then present some papers. Almost continuously for around 11 years I was presenting paper in those scientific sessions in this ISDR conferences. Got some recognition because of my involvement in the association as well as in dental research. Some of the stalwarts in that association, they recommended my name for some awards in that association. So I am the recipient of some prestigious awards and fellowships in dental research in the year 2007 and 2010. So that was related to research. I didn't stop with that. I wanted to explore the basic, the most common disease in this part of the country where I'm working now, Gujarat. So where the people have the habit of having this supari, masala, tobacco. They are very addicted. The number of cases of submucous fibrosis, one of the diseases which is caused due to that effect of this erica net and this masala, what we call that, they used to rub like this and they put it in the oral cavity. So I was very keen to study more about this, to understand this particular pathogenesis of that particular disease, because there were no drugs available. At that point of time, they were not treated in a proper way, like they used to give multiple therapies, but there's no straight cut therapy to such diseases. So I wanted to do some research on that. I approached my head of the institutes, and through government we wanted to do some research. So we have published few articles on submucous fibrosis also, and I thought this is a very basic disease of this part of the country, Gujarat. So the dentists who are graduating from this college should know A to Z about this particular disease. They should know how to manage such cases. So I thought of writing a small handbook on submucous fibrosis. And I thought I will release this book on one prestigious day, that was the 50th, the golden year celebration of my institute, Government Dental College Hospital, in 2013. So I published that book, and it was given free of cost to all the dental students who are studying, the faculties. So it was a handbook to those students and also to the young dentists who are graduating. So it gave a good compilation of the history, the clinical features, the histopathological features, and also I added on the management aspect of SMF. So it's a ready reckoner or a handbook which was useful, which still some of them are using it. So that was another contribution from my side towards this. Then we all faced the pandemic, the COVID in 2020. In April, I approached my head of the institute and said that, sir, for COVID testing, the basic requirement what they do is the nasal swab and the oropharyngeal swab. The government, WHO, ICMR, they have recommended these two methods. But when we are doing like that, there is always a possibility that the patient sneezes. When I put that swab stick in the nose, the patient sneezes, and that is creating a, the spread of this disease among the healthcare workers. The oropharyngeal swab also, when we take, there is a chance that the patient coughs because of the gag reflex. So I gave an idea that, sir, why can't we, our dentists, we can use saliva as a medium for testing the COVID positive patients. So since it was a worldwide breakthrough of that particular disease, so we have to take the permission from the government, he said. So government's permission was granted, ethical committee's approval was granted, and we started doing that study. I personally went to the 1200 bedded hospital, wearing all the PPE kit in the month of August, September 2020, when the first wave was in its peak. Collected the saliva sample from the COVID patients, and thanks to the help of the microbiology department of BJ Medical College, they did the PCR study and we published that data also. So that is another research contribution which I made. There, a lot of hurdles were there, because just a BDS graduate, how all this type of research is possible. Now, my message to all those young BDS students is, don't take this lack of MDS as a roadblock for success. With BDS degree also, there are a lot of things which we can do. And the most important and the most fascinating part of my journey here is my involvement in forensic odontology. I thank one of my mentors, whom I, considered as a very pioneer in the field of forensic odontology, Dr. J.G. Kannappan, the ex-dean of Chennai Government Dental College. He was the person who introduced me to forensic odontology in 2009. He said, you should come to this association. There is an association on forensic odontology. So he introduced me to that. I became a member of that association. And I'm proud to say now, today I am the honorary secretary of that association. So in forensic odontology, this is a path less traveled by many fellow dentists. It's not a clinical, but I can proudly say that forensic odontology is one branch which is having contributions from almost all branches of dentistry. You name any branch of dentistry, there forensic odontology is there. So I took this path. I took a study leave from Government of Gujarat to do a full-time course on forensic odontology from the then prestigious institute, that is the Gujarat Forensic Sciences University, the one and the only university in the entire world to teach forensic science. It's a university. So I did my post-graduation there with gold medal, and after that I came back to my parent institute. My dean said that you should develop a unit of forensic odontology in the college to show some uniqueness to our institute. So we started with a separate unit of forensic odontology under the aegis of oral pathology department where I work. So now in our institute, we have a functional unit which deals with almost all the medico-legal cases where the age estimation is required. Some of the cases for identification, especially the skeletal remains cases, which are referred to the BJ Medical College and other medical institutes, they are referred to us, where we apply our forensic odontology knowledge to elucidate, to actually estimate the age and identify the sex of the person and also the identity of the person. So these are the main domains of forensic odontology. It deals with, mainly the human identification in mass disaster cases. We have already witnessed in India is prone to mass disasters, maybe a man-made disaster or a natural disaster. But what is common in all disaster is the loss of human lives. Sometimes they are lost and the identity also is not, they are not properly identified also because of the dismemberment of the body, disfigurement, and also because of charring. So it goes beyond identification. So there dentistry comes first. My subject, dental subject, comes first for its identification because in some cases fingerprints may not be easily identified. Because as per the Interpol's guidelines, what they state is there are 3 primary identifiers: the fingerprint, the dental characteristics, and third one is the DNA. Of course, DNA is the standard and the gold standard method. But in many of the instances, the second characteristics, that is the dental characteristics, are bypassed. We should always give a try. We should always apply the dental characteristics. So that is what I have been telling and I've been insisting since 12th June 2025. Because though the DNA is the ultimate way of identification, but when a body gets charred, the teeth always survive. They stay as it is. That is why they are the black box of an oral cavity. Like how the black box of a flight is to be revealed the fact of the incident or the accident. The teeth reveals the truth. I always put my caption, truth through tooth. So, it's a very fascinating branch, so I am more involved into it, trying to give a proper recognition by ways of giving an awareness program, sensitizing the stakeholders. So this is very need of the hour, because the stakeholders of forensics, they are not aware. This is a very major drawback in our country. People are not aware of the situation because they think dentists are just to give, beautiful smiles. Dentists, they relieve the pain. Dentists are meant only for that. But there is other side of the coin. The dentist also reveals the truth, especially when so many dead bodies are piled in one room. How to give identity to each and every bit of a person. Dentistry always comes first in that. But very sadly, that part is neglected, not given much importance, and above all, not encouraged. So, had dental identification been given importance, some of the bodies could have been easily identified in disaster within hours. It will not take days. So this is my message, that through this podcast I want to convey this message that dental identification should be given importance. In fact, there is a need for a team for disaster victim identification, and that team should have a forensic odontologist in it. So India is having nearly 300, 350 qualified degree holders in forensic odontology. Their expertise may be taken. Wherever the incident happens, there are people scattered all over the country. So their expertise need to be taken. The association which is handling forensic odontology curriculum can be taken guidance. The institutes can be taken into consideration. So this is my request or appeal to you all people. Through this podcast, I convey this to you. Then it is not I'm not actually telling a success story, because I myself don't feel as a successful person, because a person getting recognition after death of 250, 260 people is not a recognition. It's just a contribution. So many lives have been gone, and after that, when a person gets recognition, that is not a success actually. The success is when the government makes dental identification compulsory before DNA. That is a success. If through this message, if government implements, gives job opportunities to all the forensics odontologists, that is a success. So I think there are young people here. They can always think out of the box. There are several inspiring stories I can reveal, but today we are into an era of dentistry where people are exploring other opportunities. Other options are also there. But research, and the output of the research is the data, and there is a separate science called data science. And now in the future, it is going to be AI-driven dentistry. So the young generation should think out of the box, should come out with some innovations. The government is also supporting such innovative brain students, like how to develop a student startup programs, SSIP programs. So the institute should seriously consider those SSIP programs and encourage those students who have a out-of-the-box thinking, who have some innovations, novel ideas, concepts, come out with those ideas, present it. So there is always a scope of getting success through this startup programs also. And I've been telling all this to my students in GDC. Whenever time permits, I encourage them, motivate them to do something which is new. One basic example I will give you. There are around 320 dental colleges in India. On an average, if you see, in all these colleges, if 50 teeth are extracted per day, so it will be millions of teeth extracted per year. Forget about the crowns. The crown may be decayed, crown may be deformed, may be untreated. So we may not be knowing the actual morphology of the crown, but what about the root? So when such students in a dental college, they extract the tooth, they immediately look at the root piece, root apex. The root is not fractured, so there is a sigh of relief. Okay, I have extracted the tooth successfully. Then once the approval is given by the mentor, the tooth goes into the dustbin. They throw it away. But here I want to remind that if the student is so interested in devising or in designing root morphology based implants in the future, why we have to rely on other Western countries for implants? Why can't we customize our Indian implants based on our Indian root morphology? So that is why I said people are having the scanner phones. They can use an extraoral scanner, try to get a 3D image of the root before discarding it into the dustbin. Try to analyze the root shape, root morphology, and that design can be given to an implant company, and we can come out with our own model of implant shapes and size, configuration, etc. So this is just one example I am giving you. So like that, I can go on giving multiple examples. So just to motivate the students to think out of the box and to come out with some innovations. So I think I will end my speech here. Thanks for this opportunity. Thank you very much.